Continuing my discussion on anxiety disorders, I would like to discuss claustrophobia and mention that for additional strategies to help cope with stress, anxiety, depression, and relationship concerns, please take a look at my book, Life in the Past Lane, Learning How to Focus Forward, available on Amazon as an audiobook, ebook, and paperback. Often people use the term claustrophobic when in a crowd or an elevator to describe the feeling of being closed in. Those with claustrophobia are well aware of the feelings associated with the true disorder. Dealing with small spaces can create intense discomfort and panic in a person with claustrophobia. Something as simple as riding in a car or going into a dressing room can evoke anxiety and may keep them from living a normal life. Claustrophobia can occur in children and adults, and the cause can be different for everyone, but the pattern is similar for most. Symptoms for claustrophobia present differently in children than in adults. In children who are unable to communicate the fear or whose fear has been ignored may show behavioral changes. Children may become extremely clingy, freeze up, cry, or attempt to flee when facing or anticipating going into an enclosed place. In some cases, the child may not have a clear connection between the trigger and the fear response, so the panic may seem random to a caretaker. It is important to take note of the situations in which the child shows the related behaviors. The behavior of a child with a phobia will often mimic other disorders, so it is important to explore the behaviors with a mental health professional or school counselor. For the person who is able to communicate their fear, the symptoms will include an aversion to entering enclosed places, such as an elevator, car, or small bathroom. Panic symptoms will be present, which include emotional and physical distress. The person may exhibit sweating, shaking, hyperventilating, or crying. They will experience an increase in heart rate and an extreme desire to avoid the place that bring on the panic. It is not necessary for the person to only have the panic while feeling enclosed. The panic may occur days in advance of knowing the situation will happen, such as getting an MRI. The treatment for claustrophobia is the same as most phobias and includes cognitive behavioral therapy and relaxation techniques. Cognitive behavioral therapy is used to allow the client to reframe the fear and look at it from a more rational perspective. They will learn ways to cope with the fear through relaxation, deep breathing, and muscle tension reduction. Usually the counselor will use exposure therapy to deal with the tension so the client can learn to disrupt the feedback loop, or deal with the emotions that occur when in enclosed areas that are specific to the client's fear. Claustrophobia is highly treatable. Some may be able to overcome the fear without counseling if they are able to face their fear and use soothing music, a comforting object, or trusted person to push through the fear. If the claustrophobia is severe enough, then a client may find it helpful to use medication to help in reducing anxiety symptoms. Medication can be used long-term for underlying conditions or short-term if the only concern is claustrophobia. For additional strategies to help cope with stress, anxiety, depression, and relationship concerns, please take a look at my book, Life in the Past Lane, Learning How to Focus Forward, available on Amazon as an audiobook, ebook, and paperback.